All right, parents, here we go again. It's the Ask Dr. Tony episode. This is the Experience Miracles podcast, and I'm your host, Dr. Tony Ebel, an expert in pediatrics, neurodevelopmental disorders, and drug-free, nervous system-focused healthcare. On this weekly episode, I'll be addressing the top questions on every parent's mind. If there's one thing we love and welcome, it's parents who never stop learning, asking the hard questions, and advocating for your kiddos like none other. So get ready for some real talk, real-life clinical and parenting experience, and real easy to understand answers that will help your family take action and get to that next level of health and healing. You ask, I answer. Let's dive into today's episode. All right, everybody, crazy important topic to cover with this Q&A episode. It's a question that comes up quite often. Now, numerically, statistically, it doesn't come up near as often as, hey, tell me more about birth trauma. Tell me more about these things that now, especially through this platform, parents, the other practitioners, the world is waking up to saying, hey, these are root causes. These are triggers of things like autism and ADHD. About 90 to 95% of the cases we take in with our clinic and have for the last almost 2 decades, they have a pretty dialed in perfect storm story. Now, of course, not every child's story is the same. Of course, not every child has each of the perfect storm ingredients and triggers. But the story is more common than it is different, with those high amounts of stress during the fertility and pregnancy period, especially with birth trauma, and then, of course, the whole toxic overload. That's limiting it to its simple kind of perfect storm 101 with the 3 stages or the 3 kind of categories of stress. But this question awesomely came in a few times through the platform, same as it shows up a couple of times in practice. And it's a tough one because the real deal with the perfect storm is it's never fun to go back and learn that these different stressors that our kids went through were in fact neurologically, clinically connected to the challenges they have later on with things like sensory autism and ADHD. But in the same breath, when we have that understanding, when we know those answers and we know, hey, we went through this stress, it makes sense. You then know what caused it. And then most importantly, that information is so impactful because you know what to go after. If you don't know what caused it, if you don't know the why, it's a whole lot harder to figure out what to do about it. So the question here, I didn't have a traumatic birth, but my child was still diagnosed with autism and ADHD. Why is this? It's an important question to answer. And I always spend a few minutes answering this question at every single perfect storm. I suppose there's maybe been a couple. I've done the live workshop hundreds, I think over 500 times throughout the world. And I suppose with that number of times, there's been a few times I goofed up and forgot to pre-answer this question. But even every time we do a perfect storm workshop and there's 20, 30, 40 parents in the room, we have them fill out a quick little, mini perfect storm case history. And every now and again, not every time, but there's 1 or 2 in the room that did not have that traumatic birth interventions. So when I pick up on that, I always want to make sure and answer this question there. So I'm really honored and really excited to answer this question here on the podcast for you, because I don't think to this point we have. So the first thing I want to say to answer this question is while not all neurological storms start the same, they still lead to the same struggles, and the nervous system being stressed out, being stuck on sympathetic dominance is still going to be our middleman. It's still going to be the underlying root cause, even though the things that triggered the nervous system to be overloaded and stuck on fight or flight might not be so obvious or not obvious at all in a child's case history. What we do know when we run our exams and we run our tests and our insight scans on these kiddos, even if the perfect storm case history isn't there and it kind of doesn't make sense on the paperwork, we still see an overstressed, dysregulated nervous system, even in the absence of birth trauma. Because when you open the hood to autism, ADHD, sensory, seizures, and neurological conditions, the condition, if you will, of the central and autonomic nervous system is always the same. It just has different severity to it, but it's an overstressed, overstimulated sympathetic nervous system, a suppressed, shut down vagus nerve and parasympathetic system. So overall, it's a subluxated, dysregulated nervous system. And so here's how we can start to explain that. We look at what we have always talked about in chiropractic since 1895 as the 3 T's, which is the 3 different types of stress. So there's trauma. Now that is the T, the nickname that goes with physical stress, injury. So that would be the birth trauma one. But then there's the other two T's, toxins and thoughts. Toxins would be chemical stress, right? And then thoughts would be the emotional or mental emotional stress, which is really linked to the fertility and pregnancy. So what happens is this, and it's really simple. I'm going to give you a couple of real basic, real life story analogies to really be able to understand this for your child. No matter the type of stress, those three different categories, physical, chemical, emotional, mental, no matter which one or which combination of stressors that a human's nervous system, especially a developing child's nervous system, babies, infants, young kids are very sensitive to stress, more so than we are even as adults or would be later on in life. No matter the type of stress, the body, the brain, the nervous system responds the same. No matter the category of stress, physical, chemical, or emotional, the nervous system responds by going into an acute sympathetic protective response. Now, an acute sympathetic protective response so often looks like something now said in the pediatrician's office as, don't worry, that's normal. It's the fussy, kind of colicky, not easy to soothe, they're not real sleeping, they're not real chill baby. It's that, let me go in order. It's that pregnancy, that maternal, what's called maternal stress or maternal distress during pregnancy that could be emotional because life is crazy. You have a couple of other kiddos. You're working a ton. Work is crazy. You lost a loved one. There's a little bit of a medical condition with your blood pressure or the way your placenta is attached. There's a whole long list of things that mom can go through during this prenatal, and that for the baby, that's called fetal development period, that is significantly stressful. But unfortunately, here's where this other stress sneaks under the rug and is really subtle. And you wouldn't necessarily pin the tail on the donkey and go, hey, that's correlated and that's correlated. Because we live in a world where stress is so accepted, where being just insanely busy, super chaotic, overscheduled, working a ton, checking email at night, taking extra classes, running all over the place, being exposed to freaking social media, digital, traditional news, politicians being more, the world being more at strife than ever before. We just have to call a spade a spade. Our kids, from conception to the prenatal journey to life, even if delivery, labor and delivery, is awesome. I always make the joke, I have checked kids born in a tub at home, incense burning, midwife, doula, essential oils, and those babies often have a little bit of stress on their nervous system. Well, I'm a chapter ahead here, but I'm going to come back to that little bit of stress. The nervous system, when it responds to these acute stressors and it shifts into sympathetic nervous system, for a baby and a developing child, stress begets stress. Nerves that fire together, wire together. So sorry, I said I was going to get to the next section, and I am a little bit, but that's kind of all you need to know about that. These little subtle stressors, because they show up early during sensitive periods of development, they can lead to trouble brewing beneath the surface. So it may not be a traumatic birth. You may not have a colicky baby. You may not have chronic ear infections, but then they turn 18 months and they've got some developmental delays and missed milestones. Then they turn 24 months, 36 months, age 3, 4, getting into preschool, and some behavior and some sensory and some overwhelm issues show up. Maybe they've not been sleeping that whole time, or their gut's been a little funky. They've gotten a couple of ear infections or respiratory infections, and that's led to antibiotics and corticosteroids, which are very strongly correlated to autism, ADHD, and sensory. Maybe even back in the pregnancy, there was some medications over the counter. Maybe you had a lot of pain and needed to take some Tylenol and Aleve, which now have been shown in research to have some correlations to autism and other sort of challenges later on. SSRIs, the neuro antipsychotic medications, and that class of medications have been correlated with challenges in neurodevelopmental challenges like autism and ADHD in kiddos. And then there was a study that found literally hundreds of known carcinogen toxins in umbilical cord blood at the time of birth. So even those of us who are doing everything we can to reduce our stress, handle our stress, live healthy, eat organic, eat clean, live clean, Just walk outside and look what's in the sky. Just travel on an airplane, at a hotel, in an Uber, and frickin' have Glade and Febreze and cleaning chemicals blasted to you. We live in the most high stress, toxic load world that anybody ever has. And our babies have got to grow up and develop in this. So a lot of times there really is an obvious, easy smoking gun, pin the tail on the donkey. You pick your analogy. Hey, traumatic birth, forceps, vacuum, induction, C-section, cord wrapped. When I see that in a case history, yes, I know, okay, that is the leading trigger of this child's neurological condition. We got to get in there and fix that. But I want you to know, if I've done a poor job to this point of saying, hey, even if it's not that, if it's some subtle hidden under the rug combination of some of the stressors I talked about, the other ones that could be on here is, again, those feeding, sleeping, latching, colic. You know, if a child struggles as an infant, they can't quite get that co-regulation from mom. They're not getting enough sleep. If you're lacking sleep, you're stuck on sympathetic dominance, because sleep is where the parasympathetic system does its work. We live in very overstimulating environments. There's a lot of screen time. There's a lot of 5G. There's a lot of TVs. EMF is a huge deal in everyone's household. Mold is a huge deal in everyone's household. So then there's car seats and carriers. When you really understand pediatric neuro brain development, you got to understand neuromotor development. And as a pediatric chiropractor, same as a pediatric PT, OT, speech therapist, or anybody who would know this stuff in vivid detail about neuromotor, sensory motor, brain-based connection and development, we despise pretty much every single car seat and carrier. The baby Bjorn is the most neurologically jacked up, making thing I've ever seen. There's no way a baby should ever be stuck and strapped into that posture. So this isn't fun. I don't enjoy this part of this podcast right here, where it's my job to go back and say, hey, here's the long list of bullet points that could stress our kids' nervous systems, because I agree with you. Man, I wish we knew. Man, I wish these weren't so flippin' prevalent and normalized in the world. And I wish it were so much easier to keep our kids out of this storm. I have known about this stuff the whole time I've been parenting, because the whole time I've been parenting, I've been a pediatric chiropractor and a wellness doctor. And I have studied this stuff all the way back to school on the daily. Obviously, the more years of being a doctor, the more years of being a parent that you accrue, the more knowledge and wisdom and know-how you accrue. So sorry to my first kid, Miss Addison. You know, we don't quite know what we know with Oliver, Elena, and Amelia, you know, coming down the pipe. But we still knew a lot, and we did everything we could all the time to be proactive, preventative. And I just want you to know that one of the major reasons I felt called by God to put this podcast together is even knowing everything I know. I haven't prevented every storm for my kiddos. They've gone through their challenges. And so what I want you to know in summary, and then we're going to get into the action, is this: stress in all forms, chemical, mental, emotional, whether subtle or significant, whether singular or in combination, they all affect the nervous system the same way. They are going to first shift the nervous system into sympathetic dominance. Second, that's going to lead to dysregulation and disorganization of nervous system function. And the nervous system is in charge of development of not just the brain and neuroconnectivity, but the nervous system is in charge of digestive development. The nervous system is in charge of immune system maturation and keeping a lid on inflammation. And so if your child's exposed to stress of any kind, and especially if they're exposed to stress early and often, even if they're subtle, little, seemingly insignificant stressors, they can stack up, they can accumulate, and they can add up to, later on in life, in autism, ADHD, sensory, seizure, neurodevelopmental sort of diagnosis. And again, one more time, it's easier actually to put the puzzle together when it was a wildly stressful pregnancy, and even easier when it was a very physically injurious, traumatic birth with those certain interventions. That's why we'll never shut up about birth trauma, because even that, the medical system has shuffled under the rug and said, no big deal. Don't worry about that. Everything on the list is actually a big deal. Even the little stuff. Because what happens is the nervous system takes that stress, and especially, I just have to say it one more time, if it's happening early, so fetal development, infant, postnatal development, those early stages of life, the nervous system is developing more neurons per minute than we do per day for our babies and our toddlers and our young kids. So that nervous system can be exposed to seemingly little amounts of stress and yet thrown off track and shifted into this subluxation, sympathetic overdrive, dysregulation. And then here's the final challenge that can stack up and really get us down the autism, ADHD, sensory, OCD, anxiety, seizures road. Nerves that fire together, wire together. It's called the cycle of stress. It's another reason why we nicknamed it the perfect storm, to explain the triggers that cause the neurological storm, but then that's its own perfect storm. Because once it gets stuck, it's like a CD that skips. Got to date yourself there if you ever had a CD player. Shout out to 6-disc Pioneer disc changer I had in my 1979 Mercury. It wasn't a Cougar. That was my 89. Anyways, so that broken record that plays and skips and goes through, now that creates more sympathetic dominance. Now that shuts your child's development off even more. It gets them stuck in that vicious loop. So what does that all mean? There is a root cause. It's just not as easy in their case history to find, but it's easy. It's the same process of finding it hidden within the nervous system. So it's not that their nervous system is wired wrong. It's not that their brain body is broken. It's not that it's genetic, chromosomal, DNA code discombobulation. It's just that the brain and nervous system are wired for stress. We are in that generation where more of us have been in, because we were probably perfect storm kids. So our nervous systems have layers and generations of stress on them. And so what we really need to do is to not look at this and say, okay, well, how do we treat autism? How do we cure ADHD? It's the same action step, even when birth trauma isn't involved, to help your child heal and recover. By saying, how do we rebounce, restore, and get the nervous system regulated, connected, and calm once again? And that happens even in children where it's not that smoking gun, traumatic birth primary trigger, but instead a combination of more of these subtle things. And you know what I've also had in my career? About a half dozen to a dozen where I can hardly even find the little things. But every one of those kiddos, when we tested their nervous system was still subluxated, still stuck in sympathetic overdrive, still dysautonomic and dysregulated, still had vagus nerve suppression and dysfunction. So the buttons were able to push, the adjustments were able to make one gentle neurological rewiring, restoring, repairing adjustment at a time. Then you add those up. That healing can still happen. And when we do that, sleep starts to get better, digestion starts to get better, motor planning and sensory motor function starts to get better, sensory transition starts to get better, respiration and immune function start to get better, inflammation starts to go down. And now you're from the inside out, again, you're not curing or treating ADHD or autism or sensory, but you're seeing your child's nervous system heal from the inside out. When you look on the outside and you look at their case history, it may not be as easy to say, how did we get here? But the process and the drug-free, neurologically focused action steps to get you out of the storm and to that full healing potential. And each child has a different potential. And the results in terms of symptoms and all that vary always with each and every kiddo. But when, I want to close with this as kind of the PS bonus, when they don't have that severe traumatic birth or that obvious vaccine injury or that obvious viral load that really shifted their nervous system fully, excessively in that moment into sympathetic dominance, when they don't have that sticking out like a sore thumb, one more analogy there for you before we're done with this one. I like to, kind of reset my overuse of different analogies that mean the same thing record with each podcast. When they don't have that in the case history, it actually gets us excited. Yes, it gets us a little perplexed. It gets us a little puzzled as well, because we're so used to 90 to 95% of the time seeing the dots really connect and seeing it be, for us as root cause neurologically focused chiropractors who look deeper and know this stuff, being pretty obvious how that child got into that diagnosis of autism, ADHD, or sensory. So in the cases where the case history isn't as obvious, we actually get more excited. Because guess what's hard to heal from? Birth trauma. Guess what's difficult to heal from? Vaccine injuries and the overuse of antibiotics like medications. And so all stress, no matter its form, like we talked about through this one, and no matter whether it was subtle, medium, or significant, can be hard to heal from. But less severe stress tends to respond faster, better, cleaner. And so I want to leave you with this: a less volatile, remarkable, significantly dotted case history for your child might just actually be the good news when it comes to their healing potential. I know it can be frustrating, and I know it can kind of leave you with a little bit of a hole in your investigation of like, why are we here? And again, for some parents, just a few over my 17 to 18 years, I even haven't been able to fully, entirely, confidently connect the dots to the root cause in the case history. But I'll say it one more time. But their scans and their nervous system exams played out the same. Sympathetic stuck in overdrive, vagus nerve shut down, parasympathetic shut down, nervous system dysregulation. And that's what we've got to get to work on. And that's what we got to fix. And that is what is entirely possible for your child to experience the most full, incredible healing potential possible. It's still the nervous system. It's still where the work's got to be done. It's still the foundation for healing. And I know that your child can. Keep those questions coming. I love this one. It's a little bit trickier to answer than the obvious birth trauma, perfect storm, right out of the playbook sort of case history. But I really hope that this episode really served your family and all families. And again, as always, share this like crazy, especially share it if you have a family whose child has autism, ADHD, sensory seizures, neurological challenges, and you know that they're still really lost trying to find the root cause of it, and they would just have a lot more confidence in the direction to help their child heal. If they knew the answers to that question, send them this episode. Thanks, guys. See you on the next one. Thank you for tuning in to today's episode. Do you have a question that you would like to submit? Either send it to support@pxdocs.com with the subject Ask Dr. Tony, or head on over to our socials @pxdocs, where you can submit your question in our stories every single week. Every kid counts and every family counts, so let's leave no questions left unanswered. If you loved this episode and you want to help us reach more kids, we would so appreciate if you left a review and a rating on your favorite platform. God bless. Be well. We'll see you on the next one.